Bulwinaka Fiji. Fiji's 7-day rolling average of cases per million per day remains among the highest in the world. That means we are among the highest daily cases reported for our population size. What we are experiencing right now in Fiji, we witnessed in other countries, including high-income countries, since the start of this pandemic last year. We are not alone. Countries that had similar success to Fiji in the past when it came to containing and keeping out the original virus are now suffering large outbreaks because of the Delta variant. In our daily statements, we talk about the daily toll in terms of cases and lives lost. The toll in terms of mental and social suffering is high. Frontline health workers are integral to the global response to COVID-19. In hospitals, clinics, and homes around the world, health workers are taking on significant personal risks. This is the same in Fiji. This current crisis is demonstrating the essential, tireless, innovative, and too often undervalued role of health workers and our frontline colleagues in ensuring strong, resilient health systems for everyone, everywhere. They work long hours, sacrifice time with their families, and endure the stresses that this pandemic places upon them as individuals, professionals, and upon the entire health system. Delivering health services in an environment of constrained resources will often mean providing access to life-saving care at the expense of comfort. Maintaining sensitivity and empathy during the provision of service has never been more important. It is therefore deeply saddening that I announce today the passing of a fellow health worker who many of us knew and loved. She was 44 years old and was going through a pregnancy when she turned positive for COVID-19. Unfortunately, she also had other pregnancy-related complications. Delivery by cesarean section was done to facilitate the baby's survival and to help our colleagues' critical care. Unfortunately, our colleague passed away on Wednesday, the 21st of July, from complications of COVID-19, despite the best efforts of our attending physicians. Our baby has recovered well and is in a stable condition. In the past weeks, a fellow doctor has also succumbed to COVID-19. And we may, unfortunately, see more of our fellow health workers and frontliners get severe disease in the near future. Our sympathies are extended to all those who have lost loved ones and those who are living through anxiety and fear for loved ones during this difficult time. Please be assured that this suffering have only served to strengthen our resolve to save lives. They also serve to strengthen the resolve of fellow civil servants from other government ministries and agencies who work with us in the front line to facilitate the rapid deployment of vaccines and to promote a more COVID-safe society through our community engagement program. This virus has and will continue to affect our healthcare workers from community transmission and through the course of their duties. We know that community transmission in Nosori Suva is at such a high level that it is more likely that the healthcare worker will pick up the virus in the community than in a hospital where they are wearing full personal protective equipment. Over the 3 months of this outbreak, we have transitioned from having our healthcare teams working in work bubbles during the containment phase to our current mitigation phase strategy of escalating the infection prevention and control measures and the personal protection measures to ensure that all potential and known exposures of COVID cases is as low as humanly possible among the healthcare workers. We have reorganized our PPE distribution program to ensure that the large stocks that we have are always readily available to all our healthcare workers in the front line, especially those who work in critical care units and emergency departments. By ensuring that our healthcare workers are vaccinated, well-trained in PPE use, and are diligent in helping each other to maintain PPE discipline in the workplace, we will be able to maintain our health worker numbers in our health facilities. To date, nobody who has been fully vaccinated against COVID-19 has died in Fiji. And we know this is the very best protection we can provide for all our colleagues. The potential strength of our PPE practice was clearly demonstrated in Lotoko Hospital when, during the close of the hospital, none of the staff that were actually manning the COVID wards turned positive because of the high level of PPE uses. 2 days ago, we did a press conference in the Vodafone Arena, which is the site of the Ppe Health Hospital, to highlight some of the changes that we have made to build up our extra capacity to save lives. We have increased critical care spaces and access to therapeutic interventions. We are scaling up our 165 and our 158 COVID helpline to be able to respond to requests for help. We have escalated our ability to monitor all the positive cases through phone calls and home visits, with a focus on escalated monitoring protocol for high-risk cases. We acknowledge other government ministries and agencies that assisted in creating the monitoring database and helping us with this monitoring process. We have reorganized and reinvented our case retrieval capability by working with donor agencies, CSOs, and our military and naval partners. We have refocused our swabbing screening effort to identify positive cases in the vulnerable groups in our community and in those with severe symptoms. Because we know that people within this vulnerable group are more at risk of developing severe disease and needing life-saving medical care. At the Fijian Hospital, we have seen 70% of patients with significant COVID disease go home after receiving care. 20% were referred to CWM. Unfortunately, 10% had arrived too late. In CWM, more than 60% of cases with severe diseases have recovered, with most of the deaths that occurred in CWM were because of associated severe comorbidities. The maternity unit of CWM have seen close to 400 cases of COVID-19 admissions since June, with 12 of the cases reaching a severe stages of disease. All but 3 have recovered. The underlying theme of all these recoveries from significant COVID-19 disease is that we were given the opportunity to deal with them early, either by admitting the vulnerable positive case and monitoring them, or supporting a home monitoring program that allowed timely retrieval. Unfortunately, despite these efforts, we continue to see the overwhelming majority of COVID-19 deaths have been in our most vulnerable community members who have arrived too late or succumbed at home. When our health teams first saw these patients, most of them were either in critical condition or already passed away. We believe that if our health team were able to see these patients earlier, we may have been able to save them. We know that many families are valiantly trying to care for their loved ones at home. But for those who are most at risk of severe COVID-19, home care won't be enough. These individuals need their oxygen levels closely monitored and likely need access to oxygen therapy and have clinical teams on standby who can respond rapidly if their condition worsens. So please, if you or someone you are caring for has COVID-19 symptoms and are at high risk of severe COVID-19, we need you to engage early with our 165 and our 158 helpline while your loved ones are still stable. We all have seen how the cases are building up in the Western Division. We are glad that our first dose vaccination coverage in the West is 83% at the moment, and the second dose coverage is escalating at a good rate. We have also distributed the doses to be used in Yasawa and Mamanu, the maritime area. We know that if we can delay for as long as possible the expected surge of cases in the Western Division, we will be able to prevent a lot of the severe disease and deaths that we are seeing in the Lami to Nosori containment zone. Therefore, as of Monday, the 26th of July, the following measures will be implemented and strengthened. In the West, all unnecessary movement should stop. Please stay home as much as possible. Movement outside your home must only be for approved employment purposes, medical purposes, or to get groceries. To facilitate this, the curfew hours throughout the Western Division will begin from 6 p.m. and end at 4 a.m. from tomorrow. All movements from the Central Division to the Western Division will be assessed on a case-by-case basis, and high priority for approval will be given to those who have completed 14 days after the second dose of a vaccine. All movements from Vitilevu to the Northern Division and the Maritime Islands will be assessed on a case-by-case basis, and a higher priority for approval will be given to those who have completed 14 days after the second dose of the vaccine. I will end by congratulating the efforts of the vaccination teams. Today, Ba Subdivision has achieved a first dose vaccination of 110% as they escalated to cover cane cutters and other individuals who have returned to Ba. Rewa Subdivision have achieved 104% first dose coverage. Nanronga Subdivision has 91% first dose coverage. Coverage in the Sabu town area is 91% first dose, and 30% of the population of the eligible population has received the second dose. The Maduata province leads the north with 74% first dose coverage, while Zakon Rove and Bua are sitting close to 60%. I have followed carefully the vaccination efforts through many of our Viber groups, and I'm sure that many of us in the front line take heart in the good efforts of the community in escalating their efforts to get protected, and escalating the efforts to protect all who live in Fiji, and help us all to get back to the comfort of our family. Together we can, and together we will get back to a safer Fiji. Have faith, Fiji.
Thank you and good evening. So we have 626 new cases of COVID-19 to report for the 24-hour period that ended at 8 a.m. this morning. 79 of these cases are from the Western Division, and the rest are from Central Division within the Suva-Nosori area. A full breakdown of these areas will be published later tonight on the Ministry of Health's COVID-19 dashboard and on the Fiji government Facebook page. And you can also view the approximate locations of the new cases as well as the active cases and recovered cases on the dashboard by tomorrow. We also have 9 new COVID-19 deaths to report for the period of 21st July to 25th July. The first COVID-19 death to report has been described by the Permanent Secretary, and this is a 44-year-old pregnant healthcare worker from Suva. She presented to a medical facility on the 16th of July with shortness of breath and chest pain. She was retrieved by the medical team to CWM Hospital. Her baby was delivered by emergency cesarean section on the 18th of July, and sadly, she passed away 5 days after admission on the 21st of July. She was not vaccinated. The second COVID-19 death to report is a 72-year-old man from Munikoso who died at home on the 23rd of July. He was not vaccinated. The third COVID-19 death is a 50-year-old man from Suva who died at home on the 25th of July. He received his first dose of the vaccine in May. He did not receive the second dose, and this means he was not fully vaccinated. The fourth COVID-19 death is a 61-year-old woman from Tadirua. She presented to a health facility in severe respiratory distress, and she was retrieved to CWM Hospital. Her condition worsened in the hospital, and she died 11 days after admission on the 24th of July. Her family reported that she had cough, fever, and shortness of breath at least a week prior to coming to a health facility. She was not vaccinated. The fifth COVID-19 death to report is a 62-year-old man from Suva who died at home on the 24th of July. He was not vaccinated. The sixth COVID-19 death to report is a 60-year-old woman from Vatuanga who died at home on the 24th of July. She was not vaccinated. The 7th COVID-19 death to report is a 75-year-old man from Nosori. He presented to a medical facility in severe respiratory distress. His condition worsened and he died on the same day, on the 24th of July. He was not vaccinated. The 8th COVID-19 death to report is a 74-year-old man from Nasova who died at home on the 24th of July. He was not vaccinated. And the 9th COVID-19 death is a 53-year-old man from Netasiri who died at home on the 23rd of July. He was not vaccinated. There have been 7 more deaths of COVID-19 positive patients. However, their deaths have been classified as non-COVID deaths by their doctors. Their doctors have determined that their deaths were caused by serious pre-existing medical conditions and not COVID-19. There have now been 186 deaths due to COVID-19 in Fiji, with 184 of these deaths during the outbreak that started in April of this year. There have been 242 recoveries reported since the last update, which means there are now 16,931 active cases. There have been 23,069 cases during the outbreak that started in April, and the Central Division has reported a total of 21,207 cases, the Western Division a total of 1,845 cases. The Eastern Division has reported a total of 12 cases, and these were imported cases from Viti Levu. And the Northern Division has reported a total of 5 cases, and these were all repatriated persons from Viti Levu that were contained within quarantine facilities in the Northern Division. We've recorded a total of 23,139 cases in Fiji since the first case was reported in March of last year, with 5,928 recoveries. The 7-day average of new cases per day is 804 cases per day, or 908 cases per million population per day. The testing data will be updated later tonight. In terms of vaccination, 75.1% of the target population, which is all adults, have now received at least 1 dose across Fiji, and 16.4% are now fully vaccinated nationwide. I would like to just talk a little bit now about the recent announcement in the last few days about the changes in testing strategy throughout the Suva-Nosori containment zone. As announced, for people with COVID-19 symptoms in Suva-Nosori who are not within a group that is at high risk for developing severe COVID, you will no longer be tested for COVID-19. So why are we doing this now? So when the outbreak first started in April, we consulted with the World Health Organization and other international experts to see what level we needed to escalate our COVID-19 testing to in the event of community transmission. At the time, it was decided to aim for a testing level of 3 per 1,000 population per day at a 7-day average. With the help of development partners, including the Australian and New Zealand governments, the European Union, and the World Health Organization, we increased our capacity. That included taking on more laboratory staff and included increasing our testing equipment. Right now, at the national level, our testing is averaging over 4 tests per 1,000 population per day, and in Suva-Nosori, it's at 6 per 1,000 per day. So at a population level, we are testing at much higher rates than a lot of developing countries and similar rates to high-income countries. And we are doing so with just 6 laboratories. However, the percentage of tests that are coming out positive every day is still very high. So that's our test positivity. What that indicates is that there's widespread, uncontrolled community transmission in the Suva-Nosori area. And this means that there are many more cases in Suva-Nosori that we're just not picking up with our testing. And as cases have increased in the last 2 weeks, this means that the demand for testing has also increased. This affects the turnaround time of results. And even though, just like every other healthcare worker in Fiji, our dedicated lab teams have been working beyond capacity for over 3 months now, this means we've had to re-strategize our testing to target testing to where it makes the most difference. Firstly, this will be testing of people who are at higher risk of developing severe disease, because we need to find them early and monitor them and put them into the appropriate care pathway to prevent severe disease and death. As a colleague recently said, as medical professionals, when we order for a test for a patient, we need to know why we're ordering that test. The first thing we consider is whether it would change the treatment that we would give to the patient. So most people infected with COVID-19 will have mild symptoms like cough, running nose, sore throat, fever, a loss of taste or smell, body ache, headache, and they will fully recover at home with no need for medical intervention. Even if we were to test every single one of these people and they receive a positive result, the care pathway would be the same. It wouldn't change. And then, in the case of an outbreak, we know testing is important because identifying positive cases in the containment phase of an outbreak is critical to response, because then we can isolate the case, we quarantine their contacts, and then we try to prevent further spread. However, in Suvarnasori, we are no longer in containment phase. We're averaging 1,000 cases per day, and just recently it's dropped a little bit. Our daily cases are amongst the highest in the world according to our population, and our test positivity in Suvarnasori is above 30%. So above 30% of all the samples we test every day are positive. What this means is that it's not possible for us to trace all contacts like we did earlier in the outbreak. This is part of the mitigation phase. This means that if you develop symptoms in Suvarnasori, you should just assume you have COVID-19 and self-isolate for 14 days. But in the Western Division, it's different. They're still trying to contain transmission. They're still in the containment phase. And it's important that they still test widely, including all people with symptoms, contacts of cases, and even during their mass community screenings, when they're testing people with no symptoms. And it's important that they receive their results quickly, which is why we're prioritizing the Western Division for testing. Therefore, if you live in Suvarnasori, have symptoms of COVID-19, and you're not within a group that is at higher risk for developing severe COVID, we ask that you stay at home for 14 days, isolate yourself, continue to monitor your symptoms for severe COVID-19. If you develop any severe symptoms of COVID-19, like difficulty breathing, shortness of breath, or chest pain, please go immediately to one of our dedicated healthcare facilities for COVID-19 and call 165 if you're unable to travel to one of these facilities. And if someone you care for is at high risk of getting severe COVID-19, so these are individuals over the age of 50, people with chronic illness such as diabetes, heart disease, kidney disease, asthma, someone who's obese or someone who's pregnant, we need you to get in touch right away. Come to a screening clinic, get tested, and get seen by one of our doctors so you get placed onto the appropriate care pathway and you get monitored to prevent severe disease, and if you develop severe disease, to be treated early. We're working on increasing our testing capacity, and this includes establishing a new prefabricated Fiji CDC lab in Nandi, which is due in mid-August, through the support of WHO. We've also started WHO-approved rapid diagnostic testing in certain sites in Suvarnasori. One of these sites is the drive-through testing facility at Civic Center. When a person who has COVID-19 symptoms and has high-risk factors for severe disease comes through that center, they're swabbed in the drive-through, they're directed to a parking area where they wait for about 30 minutes before they get their result. These rapid tests enable our response team to find positive, high-risk cases early and put them on the appropriate care pathway so that we can identify severe COVID-19 disease patients very early. People who get negative results through this rapid diagnostic testing system are still asked to self-isolate, and their samples are sent on for confirmatory PCR testing. We're exploring other ways of better using this rapid diagnostic testing to find the most vulnerable in our community with COVID-19. And this includes possible community outreach in the future, as a majority of our deaths from COVID-19 are still happening at home or within a few days of presenting to a healthcare facility. So essentially, our healthcare professionals in these dedicated facilities are not getting the chance to do their job and do their best to try and save people from a severe disease and dying of COVID-19. So we ask you, if you're at home right now and you have somebody who's over the age of 50, someone who has high blood pressure or diabetes, and they're having symptoms of COVID-19, please get in touch. Please bring them in to be seen by our healthcare professionals. Thank you.
Good evening. Thank you, PS and Dr. Alicia. So today marks the 101 day of the current outbreak. And as we have heard, we've now recorded more than 22,000 cases and more than 170 deaths. As we have heard, 82% of the deaths were amongst those who have not been vaccinated at all, while 18% had at least one dose but were still not fully vaccinated. We currently continue our isolation services in the hospital. In our isolation facilities in the hospital, we have a total of 332 patients who are currently admitted for COVID-19. 91 of them are in the severe or critical condition, 64 on oxygen, and we have 3 patients who are currently ventilated. Over this weekend, we've continued our screening and contact tracing work. And in the last 24 hours, we screened our stationary clinics, screened a total of 3,087 individuals and swabbed 422 individuals. Our community engagement work, led by the NDMO office and supported by government ministries and the divisional commissioners, are also working hard to raise awareness in the community, undertake some important community assessment work, as well as immediately addressing needs in the community in the area of water, sanitation, food, as well as psychosocial support. In terms of healthcare services, all our healthcare facilities remain fully functional. Emergency services at the CWM hospital is now fully operational, and COVID cases are admitted both at CWM hospital and the FEMAT field hospital, depending on the severity of the disease. General outpatient services continue in all the other health centers in the Lami Suvarnasuri area. As alluded to by Dr. Alicia, our drive-in or drive-through services for the elderly and the vulnerable commenced yesterday at the Civic Center. A total of 140 individuals were seen, and these services will continue tomorrow. In addition to what Dr. Alicia has highlighted earlier in terms of our testing criteria, or the change in testing criteria, as you have heard, for those who have mild symptoms in the Lami Suvarnasuri area, stay at home for 14 days. If you need a medical certificate for work, then you should present to your nearest health center or screening clinic or your family physician and get a medical certificate to cover you for the period of your self-isolation. Outside these areas, we encourage members of the public to continue to engage with our healthcare officials and get their advice for your care. We've also started to work on improving our management of the disease. We have established a team to support grieving families, and part of the work includes getting contact numbers of relatives, and they are in contact just to help families organize for performing the last rites for their departed loved ones. Our team in the West and the North are also working hard to contain the outbreak in their respective divisions, as well as, importantly, prepare if more cases do come up in the West and the north. To conclude, just to reiterate our important message this evening, our message is protect the elderly and the vulnerable in your families and your communities. Protect them. Don't visit, don't stay close to them, especially if you know that you are sick, you have symptoms, or have been exposed and are likely carrying the disease. Keep your distance, physical distance. Don't hug them, don't kiss them. Use your mask whenever you are outside, and particularly in the presence of those who are vulnerable, such as the elderly. Wash your hands regularly with soap and water or alcohol hand rub. Cover your mouth and your nose when you cough or sneeze using a tissue paper or the band of your elbow in their presence, but keep your distance. If they are symptomatic, please get them to be seen by our team. If you live in the Lami, Suva, Nosori area, bring them to the drive-through in Civic Center so that they can be checked and the best treatment provided for them. And lastly, make sure the elderly and the vulnerable in your families are vaccinated. And also make sure you are vaccinated. Unawalebu and good evening.